So often I'm asked the question, Chuck, what kind of conditions, what do you see most in your office? Well, 39 years and 9,000 patients later, I can unequivocally say that the great majority of conditions that come to my practice are what we call musculoskeletal conditions. What does that mean to the layman? Basically, what we see are people who come in with low back, neck related type of problems. I mean, of course, we have the headaches and we have people with torticollis and young children and athletic related injuries, but I would say low back and neck problems. So what does that mean to the consumer? The first thing I would like to share is that from a statistical point of view, it is stated in worker compensation journals that more people are out of work in America because of lower back problems than even the common cold. Now, most people will find that remarkable, but really, that's how prevalent this condition is. And I don't remember the numbers, but if you Google this information, lower back injuries, and I'll say lower back neck related, neuromusculoskeletal conditions become like an $86 billion industry. And I bring that up simply because the fascinating subject is how people will automatically default, again, running to the doctor, a pill for every ill in their endeavor to try to recover, when in fact most of these neck and back related problems are simply vertebrae, alignment issues, muscular spasm, and things that will self-correct with very strategic and simple procedures. So when you hear of people who have lower back problems, it could be anything from a disc issue, a swollen disc, a herniated disc, it could be a pinched nerve, it could be muscular spasm, but all of these type of conditions typically respond extraordinarily well to our type of work. And I think what people are interested in today is to do something that's non-invasive, non-radical, and certainly non-surgical. Now, there's always conditions that warrant more aggressive attention, but I would love for the people watching this and sharing this with their family and friends to recognize that the first step that people should do is non-invasive, non-aggressive care. So I'm very excited to be able to state that, and I don't have an exact number, but I'm going to say that 8 out of 10 people, 9 out of 10 people, if I can be so bold, typically have a very good response as a result. And the beauty of the work is simply this. I tell every patient 2 things will happen. Either you're going to stay the same or you're going to get better. That's what we see in the office. And I do recognize I am always very careful to go out with a certain amount of time to see what kind of response the patient's going to have. And it's very simple. Ladies and gentlemen, it's not just what we do, but more importantly, who is the person coming to the office? And what do I mean by that? Bring me a relatively healthy person in relatively good shape, and guess what? We have a very good response. In fact, this is the reason why children are what I call little healing machines, because most of them have not had life and lifestyle problems, i.e. excessive weight gain, on 4 medications, because all of these are factors. So once again, what I do want people to understand is that when there are these issues, chiropractic represents a wonderful, simple, non-invasive, non-radical, non-surgical approach, and it should be sought after first. Unfortunately, over the years, a lot of people go right immediately to their NSAIDs, their non-steroidal anti-inflammatories, but I invite people, read about that. You know, having an Advil, taking a Tylenol here and there, no big deal. But there are people who live on this stuff and they think that it's like candy. And you have to recognize the impact that it's going to have very strategically and specifically to your GI tract. And many times none of these things manifest in a very short period of time, but it is what happens over a period of time. So the beauty of our work, and whether people embrace it or not, but I strongly emphasize periodic maintenance care. We have a skeletal system of 110 joints. It should be cared for. And when we do, we grow older gracefully. And I think every single person listening to this tape wants what I want, and that is longevity and quality of life. But wanting it without taking action makes no sense. So I hope this helps you to understand that in the chiropractic office, bring us your neck and your back related problems. There's a host of other things, and I'm not going to take the time today because the question was, what is the most common one? But I welcome anyone, consultations, happy to provide the insight and the understanding. So the question I leave you with is, who do you know who could benefit from this type of work? Thank you.